Good afternoon. My name is Huma, and this presentation covers assertive communication, one of the key communication styles within health and social care. Assertive communication allows practitioners to articulate their thoughts and opinions while simultaneously observing other people's views and limits. This communication style, which adapts to the complexity of modern practice, facilitates teamwork, ethical advocacy, and person centered care. My goal for this presentation is to critically evaluate the advantages and disadvantages of assertive communication. Additionally, I will evaluate how this communication style can be better utilized in a real healthcare context to improve patient care and self well being. Assertive communication is generally recognized as one of the most important skills that any professional must possess, uh, particularly in a multidisciplinary and highly emotional field such as health and social care. According to study 2011, assertiveness is defined as the form of self expression that is direct, suitable, and takes into consideration the rights of other people. Assertive communication is neither as overbearing as aggressive communication that takes control, nor passive communication that refrains from expression. It puts emphasis on appreciation and respect. These features include employing I statement because they help take ownership of one's thoughts and feelings, relaxing posture and facial expression, and speaking calm yet confidently. As noted by Arnold and Bogus 2020, these features are particularly useful when one wishes to communicate assertively. In care environments, being assertive is important in relation to safely raising concern, upholding professional boundaries, and engaging in frank discussion with service users and multidisciplinary teams. Assertive communication comes with numerous advantages, making it exceptionally useful in the health and social care sector. To begin with, it enhances clarity and confidence, as reported by Arnold and Bogus 2020. Assertiveness enables practitioners to communicate their thoughts or directives in an exact, clear, respectful manner. This eliminates the probability of a great number of errors and enhances everyday communication with patients as well as colleagues. Secondly, it is of great importance in the context of person centered care when care professionals are assertive. They have the capacity to encourage service users to communicate their needs, values, and preferences. Thirdly, self advocacy requires assertiveness for ethical advocacy. As the NMC 2018 points out, all healthcare workers have a responsibility to intervene when they witness substandard or unsafe practice. Assertiveness allows them to do this in an apologetic manner. A study shows in 2011 reports that respectful assertiveness improves teamwork, defining and maintaining appropriate boundaries, fosters trust, and facilitate candidate communication within multi-professional teams. Assertive communication does have some difficulties in practice, even though it is widely recognized as a best practice, especially in the health and social care services sensitive to culture and emotion and hierarchy. Assertive communication has broad and significant relevance in health and social care. Its primary function is probably in advocacy. Professionals can employ assertiveness to raise concerns or challenge poor practice such as neglect or unsafe conditions. Nurses and carers, as highlighted in the NMS Code 2018, certainly bear the responsibility of advocacy for such scenarios. Person centered care would equally rely heavily on assertiveness. It allows for an environment where service users can comfortably share their perspectives and actively engage in decisions pertaining to their treatment or support. Communication, as emphasized by NICE 2012, is critical in achieving better care results. Assertiveness enhances collaboration and offers all professionals the opportunity to voice their ideas. Appear cold. Issues and suggestions which fosters respect in the context of teams. This develops trust among professionals, which is essential for safe, dependable, and continuous care across service of or shifts. Finally, assertiveness aids practitioners in keeping professional boundaries and distance, which can appear cold. This is concerning managing emotions that health and social care workers frequently encounter. Assertiveness is often taught as a general communication skill, but in real health and social care settings, it must be adapted to fit the diverse and complex needs of those we support. Assertiveness is often taught as a general communication skill, but in real health and social care settings, it must be adapted to fit the diverse and complex needs to those we support. Cultural adaptation is vital. For instance, in some cultures, direct speech and eye contact are considered disrespectful. Without adjusting these behaviors, staff may unintentionally offend service users or cause distress. Similarly, individuals with mental health conditions, autism, or learning disabilities may process language differently. Using visual prompts, slower pacing, and gentle repetition helps make assertive communication more inclusive. Similarly, individuals with mental health conditions, autism, or learning disabilities may process language differently. Using visual prompts, slower pacing, and gentle repetition helps make assertive communication more inclusive. Another contributing factor is an individual's age. When interacting with children and the elderly, assertive communication must be balanced with gentle tones and soft pacing to avoid coming off as rude or dismissive. This entails educatedly explaining the selections and ensuring comprehension of their rights. Even among professionals, flexibility is imperative. More junior members of a team may struggle to take a more assertive stance towards their senior colleagues. Nevertheless, with the use of some form of structure such as the DESC script, concerns and appropriately be raised, which is imperative for the safety of patient and for ethical care. The advancement of assertive communication aids in delivering safe and ethical care. Understanding the importance of assertiveness is not enough. It has to be practiced and reinforced individually and collectively at the team level. Some of the best training is done through role play and simulations. These activities allow practitioners to gain independence and emotional control within a safe environment. They have the opportunity to manipulate tone, body language, and timing without facing real world repercussions. Modules such as the DESC describe, expression, specify, consequences. Templates are equally useful. Such frameworks have clear guidelines that allow individuals to articulate issues and needs without sounding aggressive. It is particularly beneficial in situations that involve conflict or people with more power. Another great approach is reflective supervision, communicating about our communication with mentors and peers frequently allows the identification of patterns and improvement over time. To sum up, caring team culture is extremely important. Staff that feel safe to talk up if invited, assert proactively and inappropriately and consistently. This position developments not only improve staff morale but also service user safety and the quality of care provided. While preparing this presentation, I have come to appreciate how assertive communication works, and I also look into my own strengths and gaps. I have learned that being assertive is not about giving opinions. Rather, it is about doing so with confidence, clarity, and compassion. After looking back at my care placement experiences, I can now identify incidents where I chose not to speak up for myself, either because I wanted to avoid conflict or because I did not have the confidence. This project has taught me that one can be assertive while being respectful and collaborative. Thank you very much.